hotel now. I met some guy called Simon who's also having a hair transplant. So let's see what happens. It's 9 PM now. Just gonna probably get a bite to eat from locally and get some rest before the operation time. I've arrived at the hotel courtesy of the clinic. It's not too bad. The accommodation isn't too shabby, I suppose. Been advised not to eat anything after midnight, so I'm kind of hungry, so I'm going to go pop out, get a bite to eat and have an early night, I think. So I've been escorted into this room, which I suppose is going to be my room for the duration of my surgery. My first impressions of the hospital are that it's clean. It looks like it's been built quite recently. So all the areas seem to be nice and clear and tidy. Because the first thing they're going to probably do is do a blood test on me, which is probably standard procedure. They check the heart rate and etc. She ain't bad looking, I suppose, so I can't complain. So I'm at the hospital now, and this is what I'm wearing. I've got my fucking shoes on, and I'm wearing a dress. She says it's funny. I do look funny. Okay, so this is going to be my last video until after the operation. They've marked me up, met the doctor, gone through a few bits and pieces. They've done ECG tests, etc, etc. So yeah, wish me luck, and this is the last time until after my operation.
Okay, we finished basal liposuction part. Now we start the third part, the aspiration. In aspiration, I'm using a lipomatic machine, or its normal name is power-assisted liposuction. It's a Belgian device, and its properties, let me show you. This cannula makes vibration 15,000 movements per minute. It doesn't make only movement back to forward. It can also make circular movements inside the tissue. Its name is nutation. By this way, it can take more fat cells than the other classical liposuction machines. And also, these rotational movements induces contraction in the skin and inside of the tissues. By this way, it prevents the hanging skin and makes your skin more tight. Okay, see you later.
So, I've just come out of the operating theatre, and they brought me to my room. It's quite painful at the minute. My chest and my stomach is in quite bad pain. I might be slurring a bit because I've just come round for the sedation. It's now 1:10, 4 hours after they put me to sleep. I feel okay. I was freezing when I came out of the operating theatre, so they gave me an extra blanket. So I think the next thing is just going to be resting tonight. I'm assuming they're going to leave me here. So just a little rest and hope for the best.
So this is the first meal of the day, 4:30 PM. I've been in and out of sleep all day, so I'm kind of hungry. They've just allowed me to go to the toilet. They wouldn't let me get up before because of the dizziness. So I feel a bit relieved since going to the toilet. And here is my dinner, if you want to call it. I've got some kind of a soup from bread and some kind of gruel as a main course. So I'm going to get stuck in. Seem to quite bad. And my garment is all covered in blood, but they're telling me that's kind of normal, so I'm not sure if it is or it isn't. So this is the day after the surgery. It's 7:15 in the morning. I've just had some breakfast. Feel okay, not too bad. The pain is still quite, distinct. I don't feel as bad as yesterday. So I think they're going to come and inspect me a bit later on today and let me know whether or not I can go back to the hotel. So I'll let you know how it goes.
Redness on your dressing.
This is the day after the operation. I'm out of the hospital now. I'm back in my room. So I'm just going to recover here for the next day or two. Got a few bits and pieces to eat, so I've got plenty of food to eat while I'm here in the hotel room. I'm up and about now, so I can just about get to the toilet. It's still a bit painful, but a lot better than it was yesterday. So yeah, so far so good. The corset I've got on underneath here, it's kind of holding everything together. It's quite tight, quite painful to wear, but it's a necessity. So there we are. Hair clinic today, having my hair transplant. This is how it looks before. We'll see what the results are going to be after the surgery. I'm in the doc's office. As you can see, my hair is like this at the minute. The doctor's there, and we'll see how it goes.
Şey diyormuş o zaman. Herkes bir şey biliyor. Derken işte iş yapmıyor, şöyle böyle herkes beni kötüleyecek diyormuş. Ama yok. Nasıl anlamadım.
Okay, the hair transplant is now finished. So the results you can see for yourself. The full results you won't see for a few months, but it's looking good so far. Immediately after the hair transplant, you can see all the little dots, which are all the new grafts. The old hair's in between them, but it's been shaved off, so you won't see it.